Hello everyone and welcome to the Homepage Network. I'm John Boat. Today we're going to be doing another broadcast in a series of broadcasts regarding COVID-19 in Tioga County. By the way, I want to mention that beginning tomorrow morning, the Homepage Network and all of our products, the Blossburg homepage, Mansfield homepage, Wellsboro homepage, at the top right-hand section of our front page, you will find a button there that you can click onto for COVID-19 regional updates and important information regarding Tioga County. Today I have Jim Nobles with us. Jim is, of course, the president and CEO of Laurel Health Centers, and also Eric Coolidge, our county commissioner for Tioga County, is back with us today. And we're going to be talking about a number of things today regarding COVID-19 in Tioga County. And then later on tonight, I believe we're doing a broadcast with a number of doctors that will be coming in.
Yes, that's right, John. We'll have a broadcast tonight with 3 physicians to talk about some of the health concerns associated with this and answer all the questions that the public has. We're actually going to have an opportunity for those questions to be sent in. If you want to send them to Representative Owlett, he can funnel them to us if you have specific questions, and we'll have a question and answer panel with them this evening.
Yeah, so that broadcast will be taped tonight and probably will be up as soon as we can get it up.
Perfect, that's great.
Well, let's begin by asking Jim, are we ready? Is Tioga County ready for this? And
Yes.
What have you been doing to gear up?
Well, I can tell you the county is ready. We've been preparing for this ever since the outbreak was first reported back in December with the first case that was reported in China. We've been preparing for this and making our county ready and making the health systems ready. I really think the importance of this to be known is the social distancing aspect. And as the cases start to uptick in the United States and they continue to rise in other areas around the world, the importance for this region is to maintain our social distancing and take the recommendations by the Centers for Disease Control very seriously. Washing your hands, maintaining social distancing, that's of utmost importance. But what we've done here locally is something we're very proud of, and something I'll have the commissioner answer on, is what we've done locally to prepare for this.
Yeah, I know, Eric, you wanted to talk about how we can lessen the impact for our region.
Well, John, it's really critical. They put out a number of media notices indicating that there are ways that we can provide that probability lessened by the way we follow the process. Certainly the washing, 20 seconds, soap and water, hot water. Also, there's a distancing. Now, it is unfamiliar to how we act and interact up till now, but if we're going to take that, what they call the curve, and flatten it out, the earlier we can flatten it out is by following the procedure. And this is not just a commentary, it is a fact. We can follow or fall into the kind of experience that China went through, which is a number of months, or South Korea has set a bar that we should strive to. Their curve went like this and lessened, but China's went in a much more steeper incline and stayed there. So,
yeah, so what we don't want that curve to spike. We can bring that curve down if we would follow the guidelines.
Absolutely. It certainly will be critical to the way we interact with our families and keeping everyone safe and keeping the curve down.
Yeah. Jim, if someone gets sick, what do they do?
That's a question on everybody's mind, John, and a great question. I know your viewers are very concerned with this. I know the general public is very concerned with this. The first thing I can tell you is if you get sick, don't panic. The health system is here for you. As I mentioned, we've been preparing this for many, many months, so we're prepared if you do get sick. What we are asking is, if you have symptoms, contact your healthcare provider. Call the clinic first. Don't just show up on their door. Don't just show up at the emergency room. We don't want to overwhelm the health system. We want to make sure you call ahead so we can be prepared for your arrival. If you have minor symptoms, if you're just starting with the onset of this disease, or we also have seasonal flu that's going on at the same time right now, if you have minor symptoms, we're going to advise you over the phone of what to do. And it's going to be basic therapeutic measures such as taking Tylenol for your fever, taking an over-the-counter decongestant to help with your congestion. But we'll also be able to talk talk through the conditions, and if they are getting more severe, we'll advise you at what time you're going to seek care. And that's what the most important piece is. We want you to call ahead first, contact your local healthcare provider, don't just show up on their doorstep. If you do have symptoms, if you are very sick and you do need to come in, we're going to immediately mask you. We're going to maintain the precautionary measures. We're going to move you through the waiting room very quickly and get you off into exam room so we can isolate you from the other patients that are in the clinic at the time.
Okay. Eric, I know we've heard this over and over again, but you wanted to touch on the ways that we can protect those around us.
Well, clearly, following the procedures that we've talked about here thus far, but travel. Travel is another aspect of how we go to another region, and maybe here we're all right, but if we bring it back by not paying attention to where we touch, where we've been, what we're doing, for no unnecessary travel to be experienced. And by doing so, we've taken that measure in a serious way in keeping all of our needs within the county and in a controlled environment. We've exercised directives from the governor, from the president, and from our internal activity at the county by following all these procedures very strictly.
Okay. Let's talk about anxiety.
Yes.
A lot of people are very anxious, and I want to encourage you out there, don't fall into that trap where you become paralyzed with fear. You know, the Lord tells us to not be afraid, to fear not, you know, to trust God with all of our hearts. But we have people out there they're becoming anxious.
Yes. Yes. Anxiety during a time of uncertainty, it's normal. It's a normal response as the stress level ticks up around the country, as the stress level ticks up in our local area. The natural response is to be afraid. And we're starting to see some of that in our retail aspects. You can go to any store in this county, the shelves are picked bare, we're running low on paper products. What we're telling everybody is there's no need to panic. There's no need to panic. We have this under control, and we want to have a very calming voice throughout the county to know that if and when this penetrates the borders of our county, and it is probably going to, It is probably going to. We need to talk about that and make sure everyone's aware we are going to have cases in Tioga County, but there's no reason for us to panic. The healthcare systems have been well versed in planning for this for some time. Laurel Health, Guthrie, UPMC are all working together to make sure we're ready to respond to this crisis. And I cannot stress enough, if you are worried, if you are concerned, if you are sick or you start to develop symptoms, please call your healthcare provider. We have people standing by on the phones that can help deal with that anxiety measure and talk people down and let them understand that this is a virus. If you do contract it, you are going to get sick, but the severity of how sick it is going to be dependent on some other things. And that's why I'm so excited to have this physician panel here this evening to answer some of those questions and be able to go into specific detail of some of the symptoms you'll see. The very young, the very old, those with underlying health concerns. That's the vulnerable population we're looking to take care of at this point.
We have a lot of older folks here in Tioga County.
Yes, we do.
This is a retirement community, and we need to love on them and protect them.
Yes, we do.
Now, I know we'll talk more about this later on with the doctors tonight during that broadcast. But let's touch on testing, Jim, because this is something that's on everybody's mind. So let's talk about testing.
Yeah, there's a lot of questions about that. Are we testing in the area? Do we have the ability to test? And I'm very happy the doctors will be answering those questions tonight. They'll be able to answer those very specifically. Right now, we are not testing locally. We don't have any cases within Tioga County, so we're not testing patients locally, but we do have the ability to test patients that meet the CDC guidelines. If they are at high risk, if they did travel to an area of known exposure, if they do have the symptoms meeting the CDC guidelines, we can test them, and then that test is sent off to an off-site laboratory. The results get turned around, and then we can get those results out. But the physicians tonight are going to be able to go into good detail with that, great detail, and talk about our testing procedures for the county.
Okay, Eric, let's talk about the Health Summit and the task force that's been put together.
Thank you, John. And before we go any further, I want to thank you for providing this venue to communicate with the public. It's clearly a role and responsibility you've accepted and you've volunteered, I should offer, that will let us share commentary that is consistent, that it will provide an experience of those physicians who are dealing with it. with people who've been planning for it. And we want the public to appreciate that this isn't just going to happen and no one's paying attention, because that's not it at all. And part of what we've attempted to do by bringing this group of people together, our first discussion brought in the school districts, the university, various businesses, and other interested individuals in their community. The Board of Commissioners, Commissioner Hamilton, Commissioner Bunn, our Executive Director at Emergency Services, we're all wanting to bring together a group of people that can disseminate the information in an accurate and accountable way, that there will be a source. We're going to work on that as well to find a single point of dialogue. Your network will allow us to have a major play. We're going to have additional areas where we can seek, or the public can seek, additional information. But that's the part. The reason behind we coming together was there needs to be an understanding. It's being viewed. It's about bringing people together who can answer, and then that we're not done with this. We're going to follow this all the way through until they tell us we're good. So that's what we're doing.
Yeah, and let me remind our viewers once again that beginning tomorrow morning, on the top right-hand corner of the Homepage Network and all of our products, you'll find COVID-19 regional updates right there. And important information that impacts Tioga County. And you'll have that information there. There'll be a number of broadcasts that will be accumulating down the right-hand side of the page, and on the left-hand side of the page there'll be a number of channels. The commissioners will have their channel. Jim in Laurel Health will have his channel. UPMC. We will do our best to keep you up to date with the latest information as soon as we find things out. Jim, if there was one takeaway that you want to talk to the folks about as we close today, what would it be?
If someone is feeling anxious, that's normal. If you're concerned about your health at this time, that's normal. But the biggest takeaway is you're not alone. There's resources within this county that can help. We have a great task force that we stood up to advise the commissioners, and I'm so pleased to be working with a great group of county commissioners. They responded to this very quickly. They signed a declaration of emergency very quickly to open up some different opportunities, and perhaps Commissioner Coolidge can talk about that briefly, the declaration, and then I can circle back with our task force.
Yeah, thank you, Jim. And clearly, the action that the board elected to take gives opportunity for us to have, as a community, access to certain funding, certain benefits that otherwise, had we not declared the declaration of disaster emergency, we would not have been available to. And that helps us as a community and as individual entities to apply for and have access to whatever is afforded us through the state and the federal government. But without this, that does not happen. So it was an action we knew would be necessary, but we were eager to put it in play.
Okay.
And another thing the declaration does that's so important is it gives us the authorization or authority to stand up an advisory task force. So the commissioners reached out to various members of the community, and I'm very pleased to announce we have that task force established. We had our first meeting last evening. So it consists of myself representing Laurel Health. We have David Kohick on there from Countywide Emergency Services. Terry Hepp is on there from Guthrie. Andy Tom representing UPMC Wellsboro and EMS. And then the three physicians we have on there are Dr. Pfister, he's a family medicine physician with Guthrie, Dr. Gielig, he's a family medicine physician with Laurel Health, and Dr. Clark, who's a pediatrician with Laurel Health. This is going to be the council. This is going to be the COVID-19 task force that's advising the commissioners on the next steps necessary to not only mitigate this problem, but as it tends to creep up and we do get penetration within our county, we'll be well prepared and well armed to respond to this crisis.
All right. Jim, Eric, thank you both for coming in.
Pleasure.
Thank you.
Yeah, we appreciate all you do to help keep us safe and to serve our community well. We really do.
Yep.
Thank you so much.
And if I can leave with one parting thought, wash your hands. Wash your hands for 20 seconds. Anybody listening to this, I cannot stress that enough. You touch a doorknob, wash your hands. You shake someone's hands, which we shouldn't be doing, wash your hands. That's how we're going to curb this, and that's how, like the commissioner said, we're going to lessen that curve. Wash your hands. Thank you.
I think we'll end with that.
The Mansfield Laurel Health Center is now accepting patients in the state-of-the-art Susquehanna Health Medical Plaza at Mansfield. In the same facility, Susquehanna Health is offering physical and aquatic therapy, imaging, laboratory, cardiology, and sports medicine services. For more than 40 years, our 6 Laurel Health Centers have provided high-quality, compassionate care to the residents of Tioga County, offering family-based primary care services, obstetrics, pediatrics, preventive screenings, and diabetes education, as well as outpatient counseling and therapy services. Our passion is to provide comprehensive health care to all who need it with dignity and respect.